And we're live. Hello, it's Bill, the knee pain guru. Today is Monday, June 14th, 2021. Today we are going to talk about knee pain with a 75 to 80 degree flexion from scar tissue. So we're essentially going to be talking about a range of motion challenge today. And this question came in over the weekend from Caixares Median. Apologize if I butchered the name. This was so he had a femoral lengthening surgery. Now, I personally have not heard of this type of surgery before, but femoral is the bone in the upper leg, and it's a lengthening surgery. So it's lengthening the length. It's making the femur bone longer, essentially. And he writes, problems bending the knee. After removing the external fixator, I started physical therapy. External fixator, so it's like pins that go through the leg and an outside, what do you call it? Like a rod that holds the leg in place or holds the bone in place while the bone is healing. I started physical therapy, but months have passed and I still can't bend my knee. 45 to 50 degrees left active, 75 to 80 degrees passive range of motion. Right knee is still active, 45 passive. Is active 45, passive 60 degrees. People who have had the same surgery as me were able to bend their knees. I guess they didn't have scar tissue problem. However, I do not feel muscle or tendon pain when bending the knee. Just my knee hurts. I think the reason for this is scar tissue. Because my other friends have had the same surgery and they were feeling muscle pain while bending the knee, I am very different. Do you think arthroscopy is necessary, or should I do an intense massage to deal with the tear issue problem in my knee? Well, there he is. Okay. So you gave me, here, let me post this on here. So the individual that wrote the questions over the weekend is here. So it's good. It worked out well. So Caixares, you gave me two options, or as far as your question. Do you think the arthroscopic surgery is necessary, or should I do an intense massage to deal with the tissue problem in the knee? And I think there are other options. And I think this is what happens with people that are suffering with knee pain or range of motion issues in their knee, is they look at it like a black or white, like I do this or I do that. And I don't believe, by the way, my doctor said I should go through quadriplasty. Now, I never rule out surgery. Surgery is always an option. Understand this. This is important no matter what level of pain or range of motion that you're dealing with. Surgery is always an option. However, we want to leave it, or at least in my mind, if I was dealing with a situation similar to Caixares, I would always want to have that as my last option, because once I have surgery, I'm then able to reverse it. If I'm able to deal with what's going on in my knee in a natural and holistic way, well, then let's deal with that first. I'd rather try that first than go with an approach that is irreversible. So from my perspective, or from the knee pain guru's perspective, when I work with clients, we're looking at essentially when there's a lack of range of motion in the joint, the joint has tensed up to protect the knee. So there has been a trauma from this surgery that this surgery has caused. Now, this is not a judgment on the surgery. This is just Like the body reacts differently. Two people get in car accidents. One person walks away fine. The other person is laid up in the hospital. Same accident. So when you're looking at this femoral lengthening surgery, you have some people that they get the femoral lengthening surgery and then they're fine afterwards. In this case, we have a tension pattern that is developed in the knee joint and in the leg as a result of what happened during the surgery, the trauma, the experience of the surgery that has limited the range of motion in the knee, which may or may not be contributed to the scar tissue. So this is an important point, and crucial for you to get out of this video is that scar tissue doesn't necessarily limit the range of motion. Scar tissue doesn't necessarily limit the range of motion. It's the pain that from the nerve irritation that causes the body to develop the scar tissue. The pain begins to limit the range of motion because the knee doesn't want to move in that range of motion. Your body goes to move in that range of motion, and all of a sudden it goes, no, stop. I don't want to do that. Well, you do that over and over, and there is a pattern that is learned within your neurology telling the body not to go in that range of motion. So many times the range of motion has nothing to do with the scar tissue. We have to begin changing the neurology in the knee by creating comfort through getting the pressure off of the tiny little nerves in the knee, the width of an eyelash, to change the neurological state in the body, which begins to relax the tension in the knee joint and increase the range of motion. Like right there, everything that I just said there is your path to increase the range of motion. Let's see. Exactly. For example, when my physical therapist tried to bend the knee, but he can't, I scream a lot. I know. I was talking about the video that I did on Friday. I'm laughing because in some alternate reality, like this has got to seem like this whole thing, like you scream because you go to physical therapy. On some level, that's got to seem like that's not right. That's got to be like you go to a physical therapist and they're going to fix your knee and increase the range of motion and they're going to make you scream. Like there's a disconnect somewhere. Like there's got to be a better way. So Val says, my knee was injured by two dogs crashing into it a month ago. I've been intermittently elevating the knee 90 degrees and applying some ice. It's still swollen, but not as much. Today I could finally walk on it without pain, but I cannot fully bend it to ride my bike. Will it take months to heal to normal? Val, have you gone to your doctor and got a diagnosis? That's an important thing, because pain can be a result of, well, a trauma, an injury, an accident, surgery. Like trauma can be caused by that. But we have to get an understanding if there's something mechanically wrong in the knee. Like is something broken or torn? Did the did the two dogs crashing into your knees, did it cause some sort of damage? Torn meniscus, torn tendon, torn ligament, fractured bone or something like that. I'm not saying that is what happened. I'm just saying going to a doctor and having that ruled out is extremely beneficial in determining a strategy to get your knee out of pain. Whether you go the conventional medical route, whether you go a natural approach, or whether you do an integrated approach. We want to have that type of information on the table so we know what we're dealing with. I don't have medical insurance right now, but I'm working on some public assistance. And a lot of times, Val, you're able to get an x-ray pretty inexpensively. Like you can go to a chiropractor for $40. They can do an x-ray of what's going on in your knee and can determine if something is broken or torn in the knee. When you determine that, okay, let's see. Hey, Xarez, I want to buy your program, but one thing I don't understand is this online video program? Yes. We're asking for a shipping address for the billing for the credit card stuff. Like all of the clients that I work with are remote. I have two different offerings. One is a group coaching program. One is a private coaching program. They both function in the same capacity. The group coaching, we meet twice a week in a private Facebook group. You have access to a private Facebook group. We meet in a private Zoom call. And what I would say for your knee is, it's like, okay, what we want to begin doing is working with modules 1, 2, and 40 with what you have going on with your knee to begin to relax the tension pattern and increase the range of motion. Point being is, I don't work with clients in person. Unless you're in the Asheville, North Carolina area, which is, I have some people that are referred to me from time to time. But for the most part, I see everybody remotely. Okay, Val says, thank you for that info. I like natural approaches. Yeah, Val, there's always a solution, and it's important to put what doctors are doing in perspective. Like, we're evolving as a society, as a species, beyond taking whatever an authority, however you perceive that to be, as like the gospel truth, like they know everything. You know more about your body than they do. And they can benefit you in a way by providing you information because of their professional expertise. They're not going to show up and know everything about your body. This is where when we begin to empower ourselves with the knowledge and understanding of what's going on in the body, then what happens is we can take ownership of this healing process, because your body wants to heal. And the only reason it isn't healing is because there's something in the way preventing it from doing so. So hopefully that helps. I do these videos Monday through Friday in general, and answer questions in and around this. So if you have more questions, feel free to reach out. You want to go beyond this, then make sure to get into my coaching programs. Okay, Veronica says, Veronica, I have 2 total knee replacements, 2 manipulations. I'm still not able to get past 94 degrees. My PT pushes and I try to take the pain as much as I can. Veronica, I'm not laughing at you. I've heard this story so many times. Like, physical therapists, at some point, people have to go, seriously, I got to do something different. So here I am, the knee pain guru. I mean, I've heard this story so much. Is there something else I can do? I can also do numerous stretches at home. And here's where we get stuck in the black and white issue of, do I either need to do nothing or I need to push through the pain? And there is a gray area in there that functions with changing the neurology in the knee to tell the body to speed up the recovery faster. And there are things you can do while you're on the couch that can begin to change the neurology, so when you get up off the couch, your knee doesn't hurt as much. And this is where there's a huge gap in the conventional medical model. They don't have these knowledge. They don't have this knowledge, these skills, these tools, because they have a specific box that a patient needs to fit in. And they need to have a specific insurance code. And that's going to involve you fitting into that box, which requires drugs, shots, surgery, or painful physical therapy. That's their 4 options. Other than that, they're not going to be able to help you. I don't have that paradigm. I don't have that background, that knowledge. All I was a guy who loved judo, loved throwing people, blew out my knee, dislocated it 4 times, and all I wanted to do was get back out on the judo mat so I could throw people again. That was it. And after my surgery and after the physical therapy, I was still limping around. Swollen knee, I couldn't bend it. I couldn't kneel down to bow into judo class. I had to wear the big titanium knee brace. I didn't want that. So that started my journey. I started figuring this stuff out for myself 23 years ago. And now I have a couple decades worth of experience of knowing how to get people out of pain. So yes, please get into, let's see, here we go. Knee Club. All of this information is down below in the description. There's 3 options. You can sign up for my newsletter. I'll send you emails that'll start educating you and talking to you about this methodology, this approach. I have a link to sign up for a consultation if you'd like to talk to me before you want to go over everything. And I also have the link to Knee Club, which is this one right here. That is my group coaching program. We have calls on Mondays and Thursdays. Mondays at 1:30 p.m. Eastern time, Thursday at 5 p.m. Eastern time. We dig in, I ask you questions, and you tell me exactly what's going on with your knee. And then I give you specific videos in the members area of my website to begin working with. That is going to teach you how to change that neurology in the knee today, right now. And then you have an experience on the other side of that. Now, I don't know what that's going to be. Your experience of creating comfort in your knee and changing the neurology. On the other side of that, the pain may move, the pain may change, the pain may get better, like the pain is relieved. The pain can also get worse. That's the reality of when we go into a direction of doing something we aren't sure how it's going to work out. And the pain only gets worse because we're uncovering layers of tension that's been going on in your body. And then we double down on comfort so you move through that faster. Anyhow, okay, we got more questions here. I want to scoot on over to here. Let's see. Oh, hold on. Wait. Val says, I like natural approaches. We got Veronica's. We did that. Slingshot. Just got a Durolane shot in the thumb. Okay. Congratulations. I'm from Cyprus. Right now, I'm in Istanbul. I came here for to get my knee better, but the doctor said the same thing to me: manipulation under anesthesia and arthroscopy surgery and quadriplasty. I don't want to cut my body anymore. Yep, I'm able to help you. We can work with stuff as long as you're willing to put in to show up on the calls. And if you can't show up on the calls, you can type your questions in the private Facebook group. And then what I'll do is I'll answer them. I'll read the questions on the calls, and then the calls are recorded. And then you can just fast forward through to listen to what my response is. And that is if you can't make the call. Obviously, it's best if you make the call. You can ask me questions and we can interact and dialogue about what's going on, because understand that when you're in pain, you're only going to see so many options. And what we need to do is start picking apart that and opening the possibilities for your body to heal and set up those conditions. We got to set up like these little baby steps that are going to make a big difference for how your knee feels. Okay, Val says, I agree. I trust myself more than the doctors. And I heard this great quote last week. And that's essentially what we're doing here. We're getting you to trust yourself more than you trust the doctors. Not that the doctors are bad. They just need to know their role, and they'll be fine. They got a great business model. But it's important to understand that if you don't fit in that box, then their business model is not going to help you as much as you think. Okay, Val says, thank you. You're absolutely welcome. Sue says, Veronica, Renee Allen, I feel your pain. I am the same despite going to the gym to strengthen the legs. I am stuck also at 20 degrees flexion. And you know why? You know why, Sue? Is because we can't, Einstein said this, we can't solve the problem on the level the problem was created. So your knee pain is on a physical level. And if we're only looking at it from a point of strengthening the legs, and we got to push through the pain, and we got to push, and the flexion is only going so far, it's because we have to change the neurological signaling that's going on in the body that is not allowing your knee to flex beyond that point. That's what's crucial. So no matter how much you push, it's not going to increase because the neurological signaling is not being changed. The equivalent is driving around in a car with your foot on the gas and your foot on the brake at the same time and wondering why the car isn't going faster. And all you need to do is take your foot off the brake. The foot on the brake is your neurology. Your neurology is jamming on that brake because it doesn't feel safe, supported, and listened to. And when it doesn't feel safe, supported, and listened to, guess what? It tenses up, which reduces the space in the joint, which reduces the flexion and extension in the joint. So you can push that knee all day long. Go to physical therapy, have them force your knee, do the manipulation under anesthesia. So that's what happens. I'm fighting with my doctor. He's saying, I don't believe you can bend your knee without quadriplasty surgery. Then I told him if there's a problem with my muscles, why don't I feel pain when I bend? I don't get it. That's because you're believing in what the doctor says. The conflict, the reason why you don't get it is because the reality that the doctor is presenting is different than the reality that you experience and know to be true in your body. And all you're trying to do is begin to trust. And this is where you're not quite there yet. You're not trusting in your own reality more than you're trusting in what the doctor is telling you. And this is huge. And this is what Val was just talking about. Like, we need to trust in ourselves more. All I'm there to do is help you through that process and build you up, build your confidence up by teaching you how to create comfort in your knee, set up the conditions in your body and your life to support your body's ability to heal your knee, and then avoid self-sabotage. That's what it is. And self-sabotage most of the time looks like, I'm going to test the knee to see if it's going to hurt. You do it and your knee hurts, and then it puts you back in the process. When if we could just give your knee a little bit more time to rest and recover and build your confidence in how to get your knee out of pain, give it a couple weeks or a couple months down the road, you're going to be in a very different place physically as well as psychologically, because we want to set up a baseline of creating comfort. When you have a solid baseline of creating comfort, that's your new reality, and anything you do, it causes a little bit of pain, but you have the tools to bring that pain down immediately. Then you develop this confidence that you aren't afraid if your knee gets into pain again, because you know what to do. And that's what you don't have now. You don't have that confidence. You don't know what you're going to do that's going to cause pain. You aren't connecting the dots between what's going on in your diet or going on with your hydration or going on with your supplementation or exercise or stretching that is contributing to the pain in your knees. It's a crapshoot. And when you have this randomness, it'll make you crazy because you don't know what's going to make your knee better or worse. But when you create that baseline, when you follow these baby steps that I'm going to give you, that is going to create a baseline for your knee feeling comfortable on a consistent and a regular basis, Now, when you do something that's out of that baseline, you're going to know exactly what you did, how you did it, and that caused the pain, and what you need to do to get your knee back to feeling good again. It's actually quite simple. We just need to get the craziness that's going on in our head, like put that aside and be the objective third-party observer as to what's going on in your knee and your leg and your body, so you don't fall victim to that. Okay, we got more questions here. For me, if I pass this knee pain, then I could focus on my muscles pain. I'm going to buy your program today. Hope you can change my life, sir. It's been 6 months and I'm still in this situation. Yes, I will absolutely do my best. Okay, question is my total knee surgery was over a year ago and I'm still limping. Yep. So, Veronica, we need to look at what's going on in your hips and lower back too. A big part of the range of motion in the knee, and this is for Kayak as well. This is going to be important. We can't just look in the knee to look at the range of motion in the knee. We have to look at what's going on in the hips and lower back, because in order for the knee to bend, you have to have a certain amount of tension or lack of tension in the hips and lower back. And if you have tension in your hip, hips and lower back, as a result of the body compensating to protect the knee because you limp, because of the pain, because of the trauma your body's been through, what ends up happening is the tension in the hip and lower back is actually what's preventing the knee from bending. So we got to zoom out. We have to look at the bigger picture of the tension patterns that are going on from your toes all the way up to the top of your head that are contributing to the lack of range of motion in the knee. So, okay. How's that? Let's see. Lynn says, a surgeon suggested I have a partial meniscectomy for a slight tear in medial meniscus. Lynn, I would check out, they did a study. This was an interesting study. They took an equal amount of people. It was a double-blind medical thing. They took an equal amount of people that had a meniscus tear. And they separated the group of people. They took half the people and they gave them a meniscus surgery. They did the clipping of the torn meniscus. And then they took the other half of the people and all they did was do incisions as if they had arthroscopy in their knee. They didn't tell who had what. And then they monitored everybody. And over, I think it was a 6-month period of time or a couple-year period of time, I'm not remembering the details on it, they couldn't tell the difference. If the group of people that had the actual surgery compared to the people who had the double-blind surgery, and they did the same type of therapy after the supposed surgery in this double-blind study, and people had the same outcome in terms of pain. So I guess we would also have to go back. Are you suffering with pain or range of motion or what's going on? But if it's a slight medial meniscus tear, I would check out that study in terms of the results. And if you don't have to get surgery, like I was saying in the beginning of this video, surgery is always an option. But whenever you open up the inside of the body, inside of your body to the outside contaminants or what goes on in hospitals and things like that, you just want to be cautious, or at least that's what I would be. Let's see. Can I join your Facebook group? I have 2 Facebook groups. One is my Knee Pain Guru Facebook group. Everyone is welcome to join that Facebook group. You can search for the Knee Pain Guru on Facebook. The one that is part of the Knee Club group coaching program is called Knee Club. It's my Knee Club Facebook group. And that one, only members that have joined are able to access that Facebook group. And that Facebook group is where you can type in your questions if you aren't able to make the twice weekly calls. And I would read those during the call, and then you can watch the replay as to what I suggest for what's going on with your knee. Please suggest supplements for cartilage regeneration. What's very important to realize is that cartilage degeneration, we have to stop that first. Like, we got to pull the plug in the bathtub so the water can drain, as well as shut the water in the bathtub that's draining in there. We want to do both at the same time. So we have to look at diet and hydration to make sure we're setting up the conditions. So if you are taking supplements, that the supplements are going to be effective. We don't want to do something that is going to cause your body, what do I want to say? We want to raise the bridge and lower in the river at the same time to make the program most effective for you. So just suggesting supplements, I would be doing a disservice just to list off supplements, because if your diet isn't in a way that is set up, the conditions in your body is in a way that is set up that is going to continue to degenerate the cartilage, then you're wasting your money on supplements. We also have to look at what is going on, because there's wear patterns that are going on causing the cartilage to degenerate as well. If the joint is dehydrated, if there are tension patterns in the knee because of arthritis that has progressed, because all diagnosis of arthritis is dehydrated joint. So it's more than just listing off supplements, is what I'm saying. Okay, besides Durlane and stem cells, what else can be injected? Well, people inject stuff all the time. Ask better questions, get better answers. Okay, should I have the meniscectomy? Will it help with range of motion? Lynn, I don't know. Okay, let's see. Lynn, I don't know if you heard, like if you typed in that question before or after I gave that perspective on the double-blind study. So that if you didn't hear that, then that would be something you would want to check out, that double-blind study. But besides for the people that had the meniscus surgery and it was a placebo. Okay. How about silicone supplementation? Slingshot. It looks like he's got a little Canada thing. He might be in lockdown too long. Hypoxia is a thing, guys. Okay, let's see. Should I stop going to physical therapy because it hurts? I will never tell you to do something against what your doctor says. This is a choice you have to make on your own. I will give you the tools to create comfort in your knees. I will guide you and support you through the process. To understand what the signals your body is giving you as your body switches neurological states from a sympathetic to a parasympathetic state. But I will never tell you not to do something your doctor says. That is a choice you need to make. Okay. My PT doesn't want to push my knee past 90 degrees because of the tear and meniscus being compressed. Does that sound normal? Because of the tear. My PT doesn't want to push my knee past 90 degrees because of the tear and meniscus being compressed. Well, the meniscus tends to be compressed. That's how menisci gets torn. There's a lack of space. We push the joint too much, and the meniscus doesn't have room or the ability to adapt to the force that's put on it, and it'll tear. Just like paper that you twist too much, it'll begin to tear. Same thing with a meniscus. There is only so much flexibility it has if it's properly hydrated. If the meniscus isn't properly hydrated, then it's dehydrated, which makes it easier to tear, which ties in with the cartilage piece that Sushma had said. So, like I said, we need to look at many things. It's not just a one, it's not like a one-hit wonder. Like if you really want to take ownership of this process, there's lots of people that they'll take some supplements or they'll do some exercise and their knee feels a little better for a short period of time. And then they're happy with that. And that's great. I'm not your guy for that. And go to a physical therapist for that. That's just the reality of what we're dealing with. However, let's see, Lynn, depending on where the tear is, how big the tear is, the direction of the tear, the physical therapist may be hesitant to push your knee. Once again, we got to look at what's going on in the knee, create comfort in the knee. We got to look at what's going on in the hips and lower back, because that's been protecting the knee, and then get the range of motion. And if the knee still hurts, if the meniscus tear is still causing problems, well, then the surgery is always an option. That's my, okay. And then Lynn said, after. And I meant before. Blue, no green. Yeah, that's, that is, look at that double-blind study and then look at the degree of tear. Because meniscus tears can be like tiny. You can have a small meniscus tear, and the doctor could diagnose that. And your doctor could diagnose a meniscus tear that goes along the length of your meniscus. So not all meniscus tears are created equal. The more we can understand that, the degree, the direction, the location of the meniscus tear, and what it's limiting you with. Is it pain? Is it range of motion? There's some meniscus tears that can be sewn and they can be repaired. There's other meniscus tears that need to be clipped. Think of it like a hangnail. There's certain meniscus tears that can't be touched because of the location and the massiveness of the meniscus tear. So we go back, once we have that diagnosis, from the knee club approach, the knee pain guru approach, we have to look at, are you struggling with pain or range of motion? And if we can get your knee comfortable and have full range of motion, do you care what your diagnosis is? That's the reality. That's what we want to focus on. We want to keep our eye on the prize. The prize is what you want on the other side of your knee being in pain. Do you want to hike? You want to bike? You want to play with your kids or grandkids? What is that? And if your knee is preventing you from doing that, then what do we need to do to focus on getting you to that? And if you're stuck in the diagnosis and surgery or not surgery and all of that, it's important to have that information, but we want to figure out the path for you out of pain, the path for you to have a normal life and do what you want to do. We don't want to get stuck in the weeds of, like what Slingshot is putting over there, the type of shots in his thumb, or, it's a distraction. It's a slight tear in the outer portion, one inner third partial part of medial, only pain when I go past 112 degrees. So then the key would be, from my perspective, is looking at how we can create comfort in the knee to create space in the joint When we create space in your joint, it begins to get the pressure off of where this meniscus tear is. So you increase the comfortable range of motion in the knee. When we increase the comfortable range of motion in the knee, then now you're going to be able to squat down easier. And that pain may move to a different spot. And then we need to employ maybe a different, and I refer to them as pain pattern interrupts. There's specific videos that are in the members area of my website that I would point you to. What we would need to do is look at the specific location of the medial pain. The medial pain could be at the joint. It can be slightly below the joint. It can be slightly above the joint. Depending on where it's at, I have 3 different videos that I would point you towards one of those 3, depending on where it hurts. Is that making sense? And this is not about pushing through pain. This is about creating comfort, changing the neurology in the knee, getting pressure off of the nerves in the knee that are causing the pain by focusing on the intrinsic movement of the joint. Okay, let's see. I just bought your program. Can't wait to start. Good vibes. Excellent. Okay. And Kai Xares, we have next knee club call is at 1:30 p.m. Eastern time. I will send you the link to the Zoom call just in case, because the email might have gone out already, because the email for the Zoom call goes out a little bit before, so everybody has it. You can also go in the archive section of the members area. That has the links for the Monday and Thursday calls, and also send the invite for the knee club Facebook group. That's in the members area when you put in your username and password. Okay, let's see. Lynn says, what if there is a depression of the medial tibia? I guess I'm not understanding. Does it hurt? And this is where we can get caught in the weeds. The depression of the medial tibia. I immediately went like, oh, her tibia is depressed? Meaning is it sad? Never mind. Okay. Is it pain? Does it hurt? Or is it affecting your range of motion? And all we need to do is create comfort in that area so it doesn't hurt anymore, or it increases the comfortable range of motion. We can't go down that rabbit hole too far, because a doctor's diagnosis doesn't necessarily inhibit or help our process of your body healing. Okay, on the meniscus, if there's a depression, what if there is a depression of the medial tibia on the meniscus? That's probably because of the increased tension. And what happens is that squeezes on the bones and the synovial fluid in the joint, causing the knee joint to begin to dehydrate. This sets up the conditions for arthritis, and that causes the joint to wear faster, the meniscus to wear faster, the cartilage to wear faster, which is, we're back at what we were talking about with Sushma when they talked about cartilage regeneration. Once again, we have to look at the pattern. We have to look at the pattern that is going on in the joint. And if we don't address the pattern, and Lynn, it looks like you have, let's see, depression of the medial tibia on the meniscus. It's snoozing the meniscus. Okay, Lynn. And now I'm suspecting that there's some sort of spell check thing going on here. But what we need to do is make sure that the meniscus, it's from the fracture. Okay, fracture of what? So when you see that, this is when I talk about these tension patterns, that if there was a fracture in the leg, it caused the body to move differently. It caused the body to walk differently, to function differently. And when that happens, it causes different tension patterns, like in the joint. The joint has to compensate for this, for what is happening in the body. Like when you stub your toe, you limp, you shift the weight on the other foot. Well, that puts more pressure in the other ankle, the other knee, the hip on the other side. There's a chance that the shoulders are going to go up towards the ears. You're going to clench your jaw, all because you stubbed your toe on one side. So we have to look at how these compensation patterns are going on in your knee, your legs, your hips, your lower back, your hamstrings, your quads, your ankles, your feet, your shins, your calves. So when you have this 4 mm depression that's going on, that is part of probably what happened in the knee joint as a result of the fracture that you're alluding to. So we have to zoom out and look at the bigger picture of what's going on in your body, as well as zoom in on creating comfort in the specific area of your knee that's experiencing the pain. So the 4 mm depression isn't necessarily a game changer as far as anything goes if your knee doesn't have pain or struggling with range of motion. Are you getting me on this? Is this making sense? If this is making sense, give the video a thumbs up, like and subscribe to the channel. Turn on notifications for future videos as I do these Monday through Friday. So, okay, let's see. So if you want to know what to do next, you can head on over to my website, thekneepainguru.com. There's a newsletter you can sign up for there. I send emails out each day that helps change your mindset, different approach to what's going on with your knees. Second thing you can do is head on over, if you'd like to speak with me about your knees specifically, go into detail, tell me everything about it. We could certainly do that, develop a strategy for you, whether it be, medical model, whether it be a natural approach or integrated approach. We can certainly do that. And then the third option is my group coaching program called Knee Club. Certainly an option for you. I do have private coaching as well. However, I need to talk to you first. That's not something I'm willing to work with people one-on-one to sign up straight off the internet. Let's see, we got some more questions here. Hey, Bill, I reached your video. You sent me an email. Is this secret video only members can see? I'm not sure. That should get you started. That video should be like, okay, you're here. Here's where to go to sign in and log in, get your information. Begin with the quick start guide. The quick start guide is what I give every member when they first start, because it's a template in terms of, if I worked with 1,000 people with knee pain, this will help 999 of them to begin. Everything in those 5 steps in the quick start guide. And that gives you something to do no matter when you sign up, between when you sign up and our next call. So if you sign up at 2 in the morning, which many people do because they wake up because they can't sleep because their knee hurts, and now they begin with the quick start guide, they can start getting relief in their knee. And then the next call, they get the email, they can log in, talk to me on Zoom, and we take what they began working with in the quick start guide to kind of tweak and adjust everything so it's more specific. Like with Lynn, she has this medial pain. So module 40, which is the meniscus stretch, is going to be addressing that part of the knee. Now, if that meniscus stretch doesn't address what's going on the inside of her knee, then we would want to shift to either module 3 or module 5, which is above and below the knee, depending on where it is. Now, Lynn is getting into the fracture that happened. So the fracture has healed, and now the medial side of the tibia is depressed 4 millimeters, squeezing the meniscus. Can your program help me so I don't have to have surgery? I do have range of motion trouble. Yes. Yes, we can. We need to look at, because the fracture happened, caused your body to compensate a certain way. Now, even though the fracture healed, the body is still compensating. And that's what's causing the squeezing, what's going on in your knee now. Now, gone unchecked, this is how people develop the arthritis. It begins to wear. Then we're having conversations like we were with Sushma about the meniscus and the cartilage degeneration as the joints get more and more sore as a person gets older. The joint's dehydrated, it's wearing, and then we're talking about being a perfect candidate for a knee replacement down the road. When you can't take the pain long enough, when you can't take the pain anymore, and you're old enough to have a knee replacement surgery, because the joint replacements are only rated for 15 to 20 years. They're counting on you being old enough so that you'll die with the first knee replacement in. They want to saw off the bones in your leg and replace it with plastic and metal in the hopes that you won't live past the lifetime of the joint. So when the plastic and metal begins to wear, they would have to do another surgery to replace that joint, because we didn't take the time now to begin to create comfort in the knee, get the pressure off of the nerves, set up the conditions so your body can heal the knee on its own. And then you don't have to deal with that at all. Okay. Let me see. Kaitsara's. I'd need to know which video you're seeing, but pretty sure it's going to be a video that'll show you how to log in correctly and where to go first and next and all that in the members area. Because first you want get your username and password so you can get in. So you want to verify that you can get into the program. Second is you want to begin with the quick start guide. Third is you want to send the invite to the Knee Club Facebook group. And then fourth, you want to make sure you have the link so you can access the coaching call on either Monday at 1:30 p.m. or Thursday at 5 p.m. Okay, let's see. Here we go. I reached your video that shows how to access Knee Club. I guess I find finally. Good job. Okay. I just watched a total knee replacement. Anybody? So, and Lynn, I'm laughing because, shoemakers' kids have holes in their shoes. My dad had a knee replacement, and it didn't matter. Also, the definition of an expert is someone that lives more than 50 miles away from home. So it didn't matter how many professional athletes I've worked with or how many people that I've worked with around the world or that I have clients on 6 continents and like all that, blah, 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 all of the fancy stuff that I have some sort of credibility or legitimacy to what I'm doing. And my dad had a knee replacement, but then you ask him, like, what did they do? And he couldn't tell you. And there is some level of either disconnect or pride and ignorance that I'm not really sure how that works because it just isn't in my reality. They're brutal surgeries. Total knee replacements are absolutely friggin' brutal surgeries. They're literally cutting off the heads of your bone, drilling a screw down the length of your bone, and then screwing in a new knee joint that is comprised of plastic and metal. So they cut everything away from your joint. There's no ligaments there anymore. They're gone. And you're then relegated to strengthening the legs to such an extent that they can now support the joint. And your knee joint, you'll never get your heel to your butt again. You do a total knee replacement, never get your heel to your butt again. That doesn't exist. I had a martial arts buddy down in Florida. He was so pissed because his doctor didn't tell him this before the surgery. And, I was like, didn't you ask him? You're like, no, I trusted my doctor. And this is back to the conversation we had at the beginning of the call, that it's like, we got to trust in our body's own ability to heal. And I can guide you along the way if you want. Let's see. Comment. Did you see? I'm going to have to check. Hold on a second here. Yes, Lynn, it's really disgusting. It was barbaric. And Lynn, you would think 2021, we would have a better option than that. We would have a better option for painful joints than that. Literally sawing off parts of the knee bone. Yep. Yeah. Like, I don't make this up. That's what the doctors say. Length of my femur, it was like nothing, but the knee replacement is very, very hard surgery. Yes. I told the story last week of a general practitioner. She was a client of mine in Louisville, Kentucky. She was a doctor in Southern Indiana, and she was all about knee replacement, going for the knee replacement. And within a couple of years, she had to have a hip replacement, both hips replaced. So she had both knees replaced, both hips replaced. Why did the hips get replaced? Because now the tension has to go somewhere else. The tension has to go somewhere else in the body. So the hips wore out. Then she got the hips replaced. Well, guess what the last time I heard, and this was a few years ago, her shoulders were getting replaced. Because guess what? She had to compensate for the balance that she no longer had in her knees and her hips. I don't spend a lot of time talking to those types of people because I can't help them. And I will spend as much time as we need to help you. Like Kai Xarez, I will, the calls on Mondays and Thursdays, I will stay as long as we need to answer all your questions. There is a limit, though, because you actually have to do the stuff. Like, you can't stay in the headspace of like worrying about everything. You got to implement some things and then bring back feedback. Because if you don't try those things, what ends up happening is then we live in the land of theory. And the wheels aren't going to touch the ground for you. We got to get the wheels touching the ground for you, which is you moving forward and getting relief, increasing the range of motion, feeling more comfortable in your body, like all of that. And I will do what I can. And there's sometimes I will be a cheerleader for you. And then other times I will be an absolute drill instructor, because sometimes you need it. It all depends on where you're at. And this is where we're going to address the body on many different levels: physical, mental, emotional. We're going to look at breathing and mindset and supplementation and nutrition, hydration, exercise, stretching, mobility, doing the pain pattern interrupts, which is changing the neurology in the knee. Okay, says, I'm very glad to meet you, and I hope I can bend my knee with you. Yes. I mean, if you were bending your knee before, and the only thing that's happened was a surgery, then when you just need to change the neurology that's going on in the knee as a result of what happened from the surgery. And then we should be just fine. You gave me hope. And really, hope is what we want. We want a solution, or at least a direction. It's like, walk this way. And you're going to find something different. And I'm a few decades of down this road where I've figured it out. Lynn says, I'm going to try your program. Awesome. Well, thank you, Lynn. Caixares. Thanks, everybody. This was fantastic. Wow, I've been on here an hour. Okay. Well, we're going to wrap this up. You want to know where to go? Heading over to Knee Club. All this information is down below in the description of this video. This has been on several platforms. This is on Facebook and YouTube today. If you're watching the replay of this video and you have questions, type those in the comments section below, and I address those on future videos. I'm going to check Caixares. He said he sent me a question, so I'm going to look on that, see if he needs any help getting in. Knee Club starts in about an hour and 15 minutes as of the ending of this video. Let's see here. What do we got here? Lynn says, thank you. You're absolutely welcome. And that's what I've really learned. I've been doing this 13 years online, 23 years since I blew out my knee. And for those that are open and are willing, I have no problem. I will share as much or as little as you want. But for those that aren't willing, you know, that are just, I don't really call them trolls or people that they don't want to put in the work or aren't willing to look in those different areas of what's going on in their mind, their body, their spirit, of what's going on. I don't have the time because I want to put that energy towards the people that want to. So, okay. I'm going to go fix breakfast for my daughter and myself. Thank you all for being here. This has been fantastic. I truly appreciate all of the comments. This is Bill Paravano, the Knee Pain Guru, going to sign off for today. Have a wonderful day, and I will see you on the next video.